Welcome to the Positively Healthy Mom podcast, where positive parenting meets well-being. Hello, everyone. Welcome to today's episode of Positively Healthy Mom. I'm your host, Laura Olinger, and I'm very excited to introduce you to our guest today. Dr. Matt Bernstein is up in the Boston area, and he is the Chief Medical Officer of Ellenhorn and also Chief Executive Officer of Accord Mental Health. So, Matt, I'm really excited to have you on the show today. Can you share a little bit about yourself and your personal story with your sons relating to mental health?
Sure. Well, first, thanks for having me on the show. I'm really excited to talk with you. And I'm a clinical psychiatrist. I've been so for more than 20 years, trained at Mass General in McLean. I worked at McLean for a while as part of the Harvard system. And, I've always been interested in alternative approaches to try to help people get better. I've always worked with people with pretty significant mental illnesses. But things really changed for me when my kids got sick. So I have three boys. My wife and I have three boys. And about 7 years ago, when they were ages 12 and 14, they really fell apart. They were, prior to that, very well adjusted, doing well in school, playing sports, music, friends, all of that. And really almost overnight developed very severe anxiety, depression, physical symptoms. It took us a long time to figure out what was going on because it looked very much like a straight mental health condition. Eventually, we learned that there was a lot of a physical component to what was going on. They had an autoimmune condition that was attacking, essentially their immune system attacking their brain, called autoimmune encephalitis, which was caused by toxins and infections. And it took years to actually figure out what was going on and figure out how to help them. So that really opened my eyes to the idea that not all things that look anxiety, depression, and mental health maybe are that. Sometimes it's due to a physical cause. And that really changed the way I think about my job and how I try to help people.
That's really interesting because, as these kind of symptoms present, I think that the average mom out there would first start off with a pediatrician or maybe go to a psychologist or think their child should be in therapy. And you being the psychiatrist were even a little bit puzzled, like what's going on here? So how would the average mom out there kind of know to kind of persist and pursue getting some type of diagnosis like this?
Yeah, it's a great question. And it's hard. I wouldn't say that's an easy thing to know. And of course, we started with pediatrician, therapists, psychiatrists. My wife is also a psychologist, so we were looking, and we had good resources up here. We were sending them, bringing them to good people, but we really were getting no help from that system. And then the more we were looking at things, we were looking at some physical symptoms that they were having. Trouble eating, trouble sleeping. And again, those can be part of psychiatric syndromes. But then we started realizing they were getting weak. They couldn't move in the way that they used to move. They weren't able to perform in school. I mean, they literally couldn't be in the classroom. They couldn't read, even though they were avid readers before. And this started to look like way more than just depression or anxiety. But of course, in the mental health field, the doctors and the therapists will probably say, oh, no, that can be part of depression and anxiety. We just need to keep going with the medications and the therapies. But they literally were getting no help. And that's one of the signs that's really important. The other sign is if things happen very abruptly or all of a sudden. It seemed totally out of the blue. For our kids, there were two at the same time. And those two were in one middle school, whereas our other son was in a different middle school. And so that also was a clue that maybe there's something environmental going on. And, I think sometimes moms just have an instinct and they just know, probably more than dads, even though, and I would say in our case, it was the case, my wife really, she kind of knew there was something wrong with the treatment. We weren't getting help from these standard treatments. And she started looking around for there has to be an alternative explanation. She found this diagnosis called PANDAS, which is an autoimmune disorder caused by streptococcal infections. We started looking for doctors who knew about that. And sure enough, when we started getting the lab work regarding that, they had very abnormal lab work. And so, sometimes you just have to have an instinct and pursue it when things aren't working.
Mm-hmm. And so then how did that lead you into your journey on kind of this whole path of, metabolic health and, kind of bridging that gap? Like how does that meet mental health?
Sure. Great question. So initially, we were just focused on getting our kids better. And we were doing all of this alternative medicine, functional medicine, environmental medicine. But around that time when we were working on all those fronts, I heard a lecture at McLean Hospital from a doctor who was talking about using ketogenic diets to treat severe mental illness. And I was blown away by what he was describing. He was talking about reversing treatment-resistant schizophrenia with a diet, which, you know, probably most of the people in the audience just simply didn't believe what he was saying.
Yeah.
I had already had my mind sort of blown by what was going on with my kids. So it was easy for me to understand it. And I was taking note that this is really important. I want to go back to this in my career, but we still had a couple of years worth of work with our kids, and I wasn't able to apply this to my patients yet. But once my kids started getting better, I started thinking, oh, I want to start, going back to this and trying to realize, well, how can we apply these metabolic treatments to people with significant mental illness? And that was a journey that I started undertaking probably about 3 years ago, starting to apply it to people in my practice. And I've seen just dramatic benefits, absolutely incredible benefits from food, fixing severe mental health conditions, which was not part of my training. It's not part of most doctors' lexicon at all, but it's a very much emerging field within psychiatry called metabolic psychiatry.
I had never heard about that until I started learning more about it. But me personally, I'm fascinated on the topic. So I do have an autoimmune condition as well. I have Hashimoto's thyroiditis, so I'm very cautious about what I eat. And I was even having some joint pain. And I went to the doctor, and he said, "Oh, it's arthritis." And I said, "Well, should I go gluten free? Because I used to be gluten free, and I stopped." And he goes, "Oh no, that has nothing to do with." And I was like, well, I kind of think it does, but I think that there is just this disconnect in general between, and he was an older doctor. I think he was kind of close to retirement, where they're not really aware, not trained, and it's through no fault of their own, just the training isn't there to bridge that gap. And so how are you we can maybe jump ahead to this Accord program. Is this how you're getting the word out there and helping treat more patients by this program?
Yes, it is. So, at first like I said, I was doing this with my patients in my outpatient practice. And the people who were motivated, who wanted to make these changes, we were seeing these incredible results. We were able to lower medications in many instances. We were able to improve symptoms, more energy, better mood, stabilization of bipolar disorder. I was just seeing these incredible things that I never thought could come from food and metabolism. But what we also learned in this, what I learned is that it is hard. Not everyone has the motivation to make all those changes at home. And so the idea was we, created this program, which is an immersive residential program outside of Boston, where people can be immersed in this whole new way of eating, movement. There's a whole bunch of aspects to it, in a 30 to 90-day program, depending on preference and what people need, and then learn all the skills to be able to apply this when they get back home as well. So it's really about, getting a chance to try this different treatment and also learning how to sustain it so that they can continue that in their own life when they get back home.
Wow, yeah, I can imagine people listening are like, "What?" Like it kind of like my brain is like, the fact that you can treat like severe mental illness with, and you're saying maybe not everyone and not everybody's receptive to everything, but in general, that this is an approach that's working. So, can you share kind of some examples of the types of foods that are helpful, the types of foods that hurt?
Sure. So a ketogenic diet is any diet, and it can really encompass a lot of different ways of eating, but it's any diet that allows the body to produce these things called ketones, which are basically fat molecules kind of chopped up into little pieces, in bite-sized pieces that can get into the brain. And the brain loves to use ketones for fuel. And the ketones also are a signaling molecule that tell the brain to do all these wonderful things. We've known that these ketogenic diets have treated epilepsy. This started in treating pediatric or child epilepsy back at the Mayo Clinic in 1921. So for more than 100 years, this diet has been used to treat a severe brain disorder. And basically what a ketogenic diet needs to be in order to get your body to produce these ketones, you need to eat a very low amount of carbohydrates and moderate amount of protein, and most of the calories need to come from fat. And so that can be done with an omnivore diet. It can be done with a Mediterranean style diet. It can be done with a vegetarian diet. It's a little harder to do it with a vegetarian diet, but it can be done. We just need to make sure we're getting those macronutrients in the right ratios. That's the important part of it.
Mm.
And so there's not like one single food that is the most important food. Although, if I had to pick perfect foods, I would talk about things like eggs and avocados. These are foods that are ketogenic and very healthy, and have all kinds of wonderful health properties. And I think for most people do well with them. But it's really not about single foods. It's really about a style or a pattern of eating that makes the body produce these ketones.
Mm-hmm, mm-hmm.
And it's enhanced by doing some exercise. So it's easier for the body to make ketones when someone's moving their body as well. And that's also very good for metabolic health and brain health. The data for exercise and brain health is very, very solid. We've known that for now decades, how important exercise is for brain health.
Absolutely. And so, who are the patients that are coming to see you? Like, who are these people?
So these are people with a mental health diagnosis. We've had people with depression, bipolar disorder, schizoaffective disorder, obsessive compulsive disorder. Many people have comorbid anxiety, insomnia. Some of these folks come in with some significant metabolic issues as well. They may have gained a lot of weight from being on psychiatric medications, or even they may be pre-diabetic at this point, or even diabetic, type 2 diabetes, and they want to try to solve their mental health condition through this metabolic approach. They don't want to keep trying different medications, or the medications they've been on have not fully solved their problem, or they've had a lot of side effects, and they really want to use diet and exercise and mindfulness and these lifestyle interventions to manage their mental health condition. So that's
Mm.
probably the most important thing, is someone's motivated, that they want to use this approach to manage their issues.
That makes so much sense because as, a coach, I'm specialize in behavior change, whether it's parents or teenagers. And the last thing I need is a client coming who says, I'm here, but I don't want to change. Or, I don't want to do anything different. Right. It's like, well, what's the point? Right. Why are we here? And so okay, so what you're saying is the people that are come to you are open to changing their lifestyle. And I love that it's such an intensive, an immersive program. And so, what other types of care or treatment are they getting while they're there besides the food and the exercise and the mindfulness?
Yep. So we have a dietitian on staff who's helping to create this meal plan. We have a chef who's there making the food, and the chef really engages people in a lot of cooking. Because again, what we're talking about is sustainability. In order to sustain this diet and be happy about doing it, it's helpful to be able to cook some of your food. If you're not able to do that, it's going to make it a lot harder. We really try to get people's circadian rhythms aligned as well. That's a big part of metabolic and mental health. So people who are sleeping until late morning, we're trying to get them up earlier, see the sun, which is a great cue for the body to get their circadian rhythms entrained, and get to bed early, block the blue light at night before bed. So we're doing all of that. We're also doing a lot of measuring the whole time. So we're getting lots of extensive lab work before when they come, and every month we have continuous glucose monitors on people so that we can see what their glucose is doing based on these interventions. We're checking ketone levels. We're checking body composition. And so, all of that's going on while they're doing these interventions. And we're seeing the correlations between how they're feeling physically and mentally with these numbers, and what's going on with their metabolism.
That's awesome. So you're kind of able to measure progress as they go. So that way they know, okay, this works. I now need to take this out into my real life. And I love just like the totally, holistic approach, because that's really what it takes, right? Like we're not like these little test tube people. We live in the real world. And so it has to kind of like match up to the real world. I'm just curious, kind of throwing a monkey wrench in the conversation. So I'm in a class right now called Consciously Digital. And so I'm reading a lot of really cool research about how technology and how our devices impact our stress levels and our mental health in general, and how addicted that we are. All of us are. We always within a hand's reach have a phone or multiple devices. And so what can you do, or does that play a role maybe in any type of the treatment for your patients? Like, is that helpful to kind of think of that as well?
I mean, this is a broader topic than just metabolism, but it's a great question and, an important, really important topic. Yeah, we are addicted to these phones and we're getting, constantly cued by them. They're buzzing, they're beeping, they're drawing us in. I mean, people have shown that, it's harder to pay attention and concentrate, even if the phone is in the room with you, even if it's not on and you never pick it up. I mean, there's incredible research about this. There's very, very smart people at these companies creating apps that are designed to addict us, and they're good at it. And many of us are addicted. We can't go anywhere without these phones. We can't go more than 10 or 15 minutes without picking them up and doing all kinds of things on them. So it's very important to have an antidote to that, or a counterbalance to that, in my view. A period of time during the day when you're working or you're doing something enjoyable where you literally put the phone away. I turn my phone completely off. I power it down when I sleep. I think that's a really great practice for people, to just completely turn it off. And I still have a landline so that, in emergencies, people can reach me overnight. I don't want that phone on next to me. So the other way in which it plays a really important role is the blue light coming from these phones, preventing us from making natural melatonin before we go to bed. When the sun goes down, our brains are attuned to start producing melatonin, which allows us to transition into sleep. But it does a lot more than that. Melatonin is a master detoxifier, regulator in our brains, especially telling our cells to do the recycling and take out the trash, essentially, of all these toxins. And if we don't have our melatonin system working, we're not able to do that as well overnight. So it's incredibly important for health. And the blue light from the phones really does get in the way of being able to produce natural melatonin. So, even if someone is using their phone all day, I beg them, plead with them, please either turn it off for at least an hour before you go to bed, too, if they're able, or there's some settings on the phone that really do block all of the blue light from your phone. It's a little hard to find them on the Apple phone. It's under the accessibility. They have to go through about 3 different, sub screens to get to this, where you literally can remove all the blue light, but it's very important. And so for people who won't put their phone down, I at least teach them how to do that, which is a great thing to know how to do.
Yes. Yeah. I'm just thinking how helpful your program must be, even more because it is that intensive environment. And I'm sure they are allowed to have their phones, but the fact that there's so many activities, treating them instead of just being in their home environment where they're going to their psychiatrist once a week, or maybe getting a med check every 2 or 3 months, but they're still doing all the old behaviors. So in the Accord program, it's all the nutrition, all the things that we've mentioned so far. And so that like kind of total support package sounds incredibly helpful. Okay, what else do we need to know? Like, how can moms actually who are listening use this information?
Yeah, that's a great question. I think the most important message I want to give to moms is that, the nutrition and movement really matters. This is not just like a sideline thing because you want to be fit and you want to not have a, physical health issue. Metabolism affects mental health. It is mental health, essentially. And it's going to make a huge difference in someone's overall health to really think about the quality of the food, really try to get their kids not to eat so much ultra processed food, not so much sugar, all of that. It's very, very important. I wanted to cite one study that really illustrates this point. So this came out in JAMA Psychiatry in 2021. So very prestigious Journal of the American Medical Association, the psychiatry division of that journal. And they showed that kids who had the highest levels of insulin at age 9 compared to the lowest levels had a 3 times more greater risk of developing a psychotic disorder like schizophrenia. And the kids who gained the most weight during puberty had a 5 times greater risk of developing major depressive disorder when they got into their teens and 20s. So
Mm.
this really matters. This is not just, oh, it's nice to eat healthy. This is about fundamentally the health of the brain and the body. And so, whatever small things that can be done, I know it's very hard. It's hard to get kids to eat the right way. It's hard to have time to cook. It's hard. I mean, I get it. I parented 3 kids through teenage years. It's hard. I'm not saying it's easy, but it's really important and it's really worth it.
Well, I so appreciate that kind of research-based and medical-based evidence, because I feel like this is something I'm always sharing either with my family or with my clients and my followers on social media, like that these things all matter. And so it's not just like you said, like, oh, let's just go for a walk because it's good. Like, right? There's actually really good evidence about walking and sunshine and our diet and sleep and all these things.
That's right. Yeah, there's science behind this. It's not just a nice thing to do. It's also a nice thing to do, but there's real science about this is going to protect your health and protect the health of your family. It's really worth it.
What a great message. Well, I so appreciate your time today. How can people find more information about the Accord program? And if they want to follow up with you, how can they do that?
Sure. So we have a website. It's accordmh.com. So if someone just types in accordmh.com, they'll get to our website and learn all about our program. And if people want to talk to me or contact me directly, they can find me on LinkedIn. I'm one of these people that's not on all the social media channels, but I do have a LinkedIn account and I do check that. So if people wanted to get in touch with me, they can. And yeah, I just really appreciate you having me on the show. And it was great talking with you.
Absolutely. Well, again, thank you, because we never know who's listening, and I do have listeners actually from all over the world. And there, I don't know statistically, you would know what the number is that are dealing with mental health issues or severe mental illness. So there's got to be somebody who needs your help, and so I'm so happy we could bring your message today. And thank you for your time.
Thank you.